what other conditions can there be? Inflammatory bowel disease, you would have definitive inflammatory markers and you can have blood in the poop. If you have blood, fresh blood, gross blood in the stool with diarrhea, it is not just IBS. Irritable bowel syndrome, by definition, does not give blood in the stool. You don't poop blood with IBS. If there is blood, it has to be taken seriously. It could be a significant condition like inflammatory bowel disease or colon cancer. So those have to be addressed. Black poops is not normal, so that needs to be investigated if there is blood in it. Microscopic blood can be found in black poops, and that means upper GI bleeding of somewhere. It could be bad acid reflux disease, it could be ulcers, or in rare cases, and depending on the age, esophageal or stomach cancers. So ulcers and all that can happen and they need to be investigated. Therefore, irritable bowel syndrome, by just looking at the patient and history alone, may point you toward that diagnosis, but depending on your age and other symptoms, other conditions need to be ruled out. So for the most part, there are criteria used. We call it Rome criteria, where experts sat down together and came up with the criteria to diagnose irritable bowel syndrome. But then again, individual cases have to be looked at. You cannot just do one broad brush for a diagnostic workup for everyone. Giardia infections, ova and parasites have to be checked in the poop, because Giardia infections can give you, it is a protozoa, it can give you similar symptoms. Clostridium difficile infection, which can occur if you use a lot of antibiotics over a period of time. Your gut microbes change, and C. diff, which normally stays with you as a commensal or as just a bacteria bystander, can become pathogen and create colitis. Then you can have blood in the stool, you have significant diarrhea. Infectious diarrhea typically lasts about 1 or 2 weeks, but they need to be ruled out. Uncommon infections can also behave like irritable bowels, so those need to be ruled out. Stool testing is very, very important. We do test for blood. We do test for calprotectin, which is an inflammatory marker, calprotectin. If it's significantly elevated, it is not just IBS. Then you're dealing with probably some inflammatory bowel diseases like Crohn's and colitis. Irritable bowel syndrome, because it's a gut-brain interaction issue, you have to remember that irritable bowel syndrome can occur with certain conditions of mental health disturbance, like anxiety disorders or depressive disorders. So anxiety and depression may go hand in hand with irritable bowel syndrome. It is fascinating to know that 95% of your serotonin, or the happy hormone, comes out of the gut. Only 5% of serotonin is secreted in the brain. And you see how an important role serotonin plays in anxiety and depression. Just imagine how much of it is secreted in the gut and how sensitive tissue the gut is. There is a 60 to 70% chance of you having anxiety and depression if you have irritable bowel syndrome. That is the reason why a subset of irritable bowel syndrome can also be treated with cognitive behavior therapy from psychologists or hypnotherapy. Gut-specific hypnotherapy has shown to help in irritable bowel syndrome patients. Then there is a treatment through the food modification. There's a diet called low FODMAP diet, FODMAP. It stands for fructans, oligosaccharides, polyols. These are the sugars of different kinds. So they are present in the food in the forms of fruits, vegetables. There are high FODMAP fruits and vegetables, and then there are low FODMAP fruits and vegetables. So irritable bowel syndrome treatment initially starts with low FODMAP diet trial. So you avoid high FODMAP fruits, which are high in oligosaccharides, fructose, and polyols, and you go with the low ones. So in that sense, you're going to avoid like apple, mangoes. Instead, you go with bananas and berries which are low in FODMAP. Again, you avoid onions and garlic because they are high FODMAP, but you go with chives. Now, it has to be understood that high FODMAP, which are high in sugars, are not a long-term solution. It's a 4 to 6 week offer that shows that if you avoid that and if your symptoms improve dramatically, then you are amongst that subset of irritable bowel syndrome that responds to the dietary modification. Not all IBS are going to respond to the low FODMAP diet. But if you go low FODMAP diet and your symptoms improve dramatically, that's good, because then you have a chance that once you are reintroduced to the high FODMAP food one at a time as second step of the FODMAP diet therapy, then you may find a culprit. When you're slowly introducing one item at a time, you may find there are very few items that you react, and those can be taken out of your diet forever as step 3 of the FODMAP dietary therapy. So the reason why high FODMAP diet cannot be avoided long term is because many of the prebiotic food containing prebiotics, the soluble fiber, are present in the high FODMAP. Apple is one of the examples. Onion and garlic, they're also prebiotics. You cannot avoid them forever, because then you start missing out on providing prebiotic diet to your gut microbiome, who need it to ferment it to produce short chain fatty acids, the very molecules, the gems that are going to make your health improve in all aspects: cardiovascular, brain, gut, skin, everything improves if the prebiotics are enough in your body. So that is the story about the low FODMAP diet. So FODMAP diet therapy is done systematically, and interestingly, Monash University has done a lot of research work on it, and they have come up with therapy that many dietitians now follow. So with the help of a gastroenterologist, you can then find a dietitian who can help you go through that FODMAP therapy process. Remember, the process is you avoid high FODMAP and you go with the low FODMAP for 6 weeks, and after that you are slowly reintroduction phase. You introduce one item at a time from the high FODMAP to see which one your body reacts to. And stage 3, then you continue, you maintain your diet, including some of those high FODMAP that your body can tolerate. Remember, you cannot stay away from high FODMAP forever, because many of those are soluble fiber, which are actually prebiotics, which your gut microbiome thrives on. So that is the story about the irritable bowels.